Good evening and welcome to Chicago Tonight. I'm Paris Schutz. Brandis Friedman has the evening off. On the show tonight,
we do expect cases to be high. As Dr. Awadi said, the children have been in the community.
One-on-one with the CEO of Chicago Public Schools, we discuss the COVID safety plan in place ahead of Monday's in-person return.
Chicago is breaking records for daily COVID cases, so is the state, and so is the nation.
Our hospital is equipped to handle this latest COVID surge. That and more with a local infectious disease doctor.
This was a bill that was almost 20 years in the making.
The new year brings new laws on handling unused medicine, fertility treatment, vaping, and much more. How the pandemic has caused death rates to skyrocket for dialysis patients.
Fields in all sorts of trouble, and he's going to be dropped.
Justin Fields is back in practice after rib and ankle injuries, but should the Bears risk him against the Giants on Sunday? Just keep swimming. Meet a woman taking her love for aquatic life and transforming it into a business. And the mighty Chicago Symphony Orchestra returned to the stage in 2021. We sit down with the maestro, Riccardo Muti. But first, some of today's top stories. A federal court decision upholds new legislative maps drawn by Illinois Democrats. Republicans, the NAACP, and MALDEF brought the suits, arguing Democrats did not follow federal voting laws meant to protect minority voters. The judges did note that Democrats were overtly political in drawing borders of new Illinois House and Senate districts, but added the map is, quote, legally acceptable. Illinois Senate Republican leader Dan McConkey issued a statement saying, quote, Governor Pritzker could have kept his promise to support independent redistricting, but instead signed a map that was ruled unconstitutional and another that was opposed by voting rights groups throughout Illinois. The ruling will help Democrats in the state legislature for the decade to come. There's a new record high in single-day COVID cases in Illinois. State public health officials report more than 30,000 new COVID-19 cases and an additional 87 deaths. That brings the total number of cases since the pandemic began to more than 2.1 million and 27,821 total deaths. And the statewide test positivity rate is more than 14%. One of those new positive COVID cases is Illinois Lieutenant Governor Juliana Stratton. In a tweet, Stratton says she has mild symptoms and that she's relieved to be fully vaccinated and boosted. Stratton went on to encourage others to get vaccinated and to wear a mask. Illinois Congressman Chuy Garcia and his wife joined Stratton in testing positive today. And this week, Illinois Congressman Bobby Rush announced he also tested positive for the virus despite showing no symptoms and being fully vaccinated. About 68% of the state's population aged 5 and older is now fully vaccinated. Extra rounds of available booster shots could soon be given to young people. The FDA is expected to expand Pfizer's vaccine booster eligibility for kids ages 12 to 15 years old in the next few days. The news comes after child hospitalizations loom large across the country due to the Omicron variant. Infectious disease doctors say the hospitalization surge is likely caused by a low vaccination rate and not receiving that third dose. And up next, one-on-one with Chicago Public Schools Chief Pedro Martinez. So please stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
Today marked the last day for Chicago Public School families to turn in their at-home COVID test for students ahead of Monday's return to in-person learning. On Tuesday, CPS distributed over 150,000 PCR tests at more than 300 schools in communities hardest hit by the pandemic. Students who test positive are required to stay home. And joining us now to discuss the return to school and safety protocols in place amid the Omicron surge is CEO of Chicago Public Schools, Pedro Martinez. Pedro Martinez, thank you so much for being here. And as you know, we're seeing record case hauls right now with COVID. Why do you still believe it is safer for students and staff to be in school come Monday versus at home?
You know, one of the things that I'm very proud of, Paris, is just all the procedures we put in place in our schools. We've made investments in our district And one of the things we've seen, and the evidence has been very clear, as you look at data, ever since really we started the school year this year, our cases have always been much lower than the community's cases. In fact, what we see is cases start in the community and they come into the schools. And we've been very conservative in our approach. In fact, as Omicron was coming in right before we went on break, we were transitioning more classrooms to be remote. And sometimes I think it confuses our parents because they think that somehow that we're seeing outbreaks, but we're not. We actually are moving very proactively to make sure that we prevent outbreaks. So that's the one thing that I will continue to let parents know. Don't misinterpret that as we're seeing those actions. But I am very confident that we are ready for our children. And we also know that the best place for children to be is in schools. Their academic, their mental health and social well-being suffers. And we have seen it suffer when they were remote.
And you're going classroom by classroom to determine any kind of remote learning as opposed to school-wide or system-wide. You mentioned those 150,000 mail-in tests. We saw pictures of overflowing drop boxes. Are you getting all of those results, and have you seen some of the results yet?
I'll tell you, first of all, I think it was great to see those pictures that are overflowing because it shows that our parents are taking it seriously. And we were able to pick up all of those tests. In fact, FedEx and Walgreens and our libraries have been great partners in this. And we even have FedEx has actually been doing even more check-ins on those drop-in sites. So for me, I actually saw it as a positive. All of those tests were safe. They were in waterproof packets. I can tell you that they're being received by our lab. By our vendor that has a lab. Over 37,000 accounts as of this morning were already set up, which means that those tests were already being delivered and being processed. So for me, it's going to provide us very valuable information because children, as you said, who test positive will be asked to be at home. But more importantly, we know then that children that test negative, that they're coming in safely and that our schools will continue to be safe next week.
And are you anticipating a high positivity rate from those tests?
I am. One of the things that, because the children have been in the community. So sadly, and this is one of the things that data has shown, not only here in Chicago, but cities across the country, when schools are closed and children are in community because they have their guard down, because they're not wearing masks, you see cases rise. And we believe because, we've been on break for 2 weeks, we're going to see a rise in cases, which is why it's important for us to catch those cases, as many as possible, before they come back on January 3rd.
Well, it's not just concern among students and families, but also teachers and staff. And on Tuesday, we heard from CTU Treasurer Maria Moreno asking rapid testing to be available to students as they walk through the doors on Monday. Let's take a look.
For all students and all workers in the building. So when they're coming in the morning, they should be tested. That will give us a clear indication of, where is the level of transmission of COVID in the homes, right? And I think that's a very big concern because we really don't know what's happening in the schools because there's very little testing going on.
What about that, Pedro? Rapid testing for students once they come back and enough tests for students perhaps to get tested more than once a week?
Here's the reality. There is a short supply of testing across the city and across the country. The Biden administration even admitted that, that's one of the areas they fell short, and they're trying to do more in the month of January. So we have seen that. But even with that, I'm very proud of the fact that we were able to get 150,000 home PCR tests, which are much more accurate. And we targeted the communities that we know are more at risk. So I feel that that's a much better approach. The challenge with testing is that it's at one point in time. Rapid tests are not as strong as PCR tests. And for me, my fear is that it'll give us a false sense of security. For us, the number one solution really has to be vaccines. Tests are not going to protect our children. It's going to be vaccines. Now, I'll tell you, one of the things that makes me very proud also, over 91% of our staff are vaccinated. Almost all of our teachers are vaccinated, with many now getting boosters. So as we look at, the conditions we are under today versus in the past, we're in a much better place as a district. And frankly, our staff are in a much better place now that they're vaccinated and with many, again, that have boosters.
And you said before that you're going to be very conservative in terms of sending classrooms remote. Can you share with us the metrics that you would use to determine whether or not a class is going to shut down and the students will go remote?
So one of the things that we're seeing in our city is that vaccination rates are so uneven across the city. I have schools where over 80% of the children are vaccinated, and I have other schools where under 10% of the children are vaccinated. In those types of situations, we have empowered our principals that as they see cases coming into the schools from the community, that they have the ability to transition those classes immediately to remote, even before we do contact tracing. And we started doing that during the break. I just believe that our principals and teachers who are closest to our children, they're the ones that can see those risks much quicker. We will also have a team that will be working with schools directly. And that team will represent the health department, our health team, our facilities team, our talent team, so that we can address issues that are specific to that school. We just feel this is a much better approach because we're looking at classroom by classroom, school by school. The reality is that COVID has been very uneven in our city, and it doesn't make sense for us to be, being impulsive and making drastic decisions that affect an entire district. And by the way, when the entire city is open, we're talking about, restaurants and theaters and events are open. So where does it make sense to have schools closed when we know our schools have been very safe? And the data has shown cases have been very low at schools compared to the community.
And certainly not a one-size-fits-all proposition here. Are there contingencies in place in case teachers or staff members go down with COVID, they have to miss class, given the fact that there have been shortages of substitutes in the past?
We are watching that data very carefully, Paris. So we're not seeing any higher requests for substitutes for next week as we have in the past. In fact, we've enhanced the rates of our substitutes even for the month of January so that we're getting even more coverage than we have in the past. So we're going to continue to watch that. The good news is that because so many of our staff are vaccinated, even when our staff get COVID, symptoms are very mild. And now with the new guidelines, we're even able to bring them back sooner as long as they don't have symptoms. I feel we're at the other end of this.
And there might be parents out there that are still saying, well, we haven't tested positive yet, but I'm keeping my kids home, at least for the time being, next week, because we're just afraid of sending them to school. What's your message to those parents?
I'm a parent of 2 children myself. My children are fully vaccinated. Even with that, we got them tested today. And so I understand that there's anxiety. We'll always respect a parent's wishes. But what I would, suggest though, as let's look at what's happening in your classroom. Let's look at what's happening in your school because COVID has been so uneven across the community. And again, I just ask parents to be patient with us because we will see more cases. We will see more children transition to remote. And in those situations, we'll make sure that they have devices. We'll make sure they have work to do. But we want to be thoughtful about it. We don't want to be impulsive, and we want to make sure we're using the science and using actual data that's actually available to us.
All right, Pedro Martinez, a lot to manage here, and our thanks to you for being here. Thanks very much.
Thank you for having me, Paris.
Healthcare, even with insurance, can be expensive. A series of new laws could make it easier for consumers to comparison shop for prescriptions, make sure unused medicine doesn't go to waste, and expand coverage of fertility treatment. Amanda Vinicky joins us now with more. Amanda.
There's a saying thought about often, I think, during the pandemic, that if you don't have your health, you don't have anything. But for some people, affording medicine to keep their health in check is out of reach. This even as a lot of drugs go to waste. Maybe your pharmacy benefits manager sends medicine via the mail before you need it, letting prescriptions pile up. Perhaps a loved one dies and has leftover unopened drugs in their medicine cabinet. Or maybe you buy an extra bottle of over-the-counter pills. A new law, the Illinois Drug Reuse Opportunity Act, will allow these drugs to be donated. Pharmacists can collect and help to dispense them. Head of the State Pharmacists Association, Garth Reynolds, says the law is 20 years in the making.
Right now, we're looking at whole box medications. So we're not talking about, you got 5 tablets of something left. We're still talking about unused box medications for the most part, or unit of use medications that are still sealed, and at least in the beginnings. And this will allow us to be able to take these medications back and get them to people who still fall into the underinsured population and make sure that they have access to be able to get this needed care, that they may not be able to afford the medication any other way.
He says that Illinois is modeling the program after one that's been successful for years in Iowa. Now, here is another new law. When you go to the pharmacy in 2022, you may begin to notice a new sign posted alerting you that when you buy a prescription, you are entitled to request the retail price of the drug. Reynolds says that, like other products, medicine's price varies from place to place, say CVS to Walgreens. Sometimes the cash price is cheaper than what a drug would cost with insurance, even a copay.
This is where it is good to be an educated consumer as well as being an educated patient. And just as you look for the best price at other businesses for other products and services that you receive, you should also be doing that for your medications.
Another law taking effect Saturday deals with insurance coverage for fertility treatment.
Now, our insurance law in Illinois only covered people who can get biologically pregnant, so women, and conceive, and they have to try 12 months with their partner. So automatically, you're excluding an entire group of individuals, mostly LGBTQ, people who want to have a family.
But also excluded single individuals who don't have a partner and still want to become moms. Now, out-of-pocket fertility treatments can be really expensive. It can cost tens of thousands of dollars to conceive a single child. State Representative Margaret Croak says a constituent, a doctor in a same-sex marriage, raised this issue with her. And at the time, Croak was 3 months out from giving birth to, you just saw him there, her now 2-year-old son.
The idea that because I was able to conceive naturally and I'm a woman and I'm married to a man, I'm able to have a child. But this man who is married to the most wonderful partner who happens to also be in a same-sex relationship, I'm taking that opportunity away. Like our society, the cost of fertility is taking that opportunity away from that family just was really incredibly heartbreaking for me. And I didn't think it was fair.
Now that's changing. Illinois-based insurance plans will now have to cover fertility treatment for same-sex couples as well as single individuals. Also, women over age 35 no longer need to try for a year. It's cut in half to 6 months before coverage kicks in. Also, if a doctor verifies that there's a medical issue behind the infertility, there's no longer this requirement to fruitlessly try to conceive naturally for 12 months. Pregnant people, also new in 2022, can use a disability placard to park in handicapped accessible spots during their 3rd trimester. It's got to be a relief for moms. Another new law aims to reduce youth vaping. Illinois will prohibit marketing e-cigarettes to those under age 21, and this ban also bans marketing that promises that vaping is a low-risk alternative to regular cigarettes. Now, also, finally, starting on Saturday, Illinois insurance plans must cover pancreatic cancer screenings. We are going to have more new laws later in the program. For now, Paris, back to you.
Illinois has been setting records with new COVID cases all week. State public health officials announced more than 30,000 new cases, blowing past the old record of 21,000, and the state reports 87 additional deaths in the last 24 hours. More than 5,600 people are hospitalized with COVID currently, and COVID patients are occupying 34% of the state's ICU beds. And joining us to discuss the rising cases and more is Dr. Allison Bartlett, Associate Professor of Pediatric Infectious Diseases at University of Chicago Medicine. Dr. Bartlett, thank you so much for being here. First of all, we're seeing these staggering amounts of new cases. Can we at least be assured that the death rate won't be what it has been given the rate of vaccination and the relatively milder Omicron symptoms that have been reported?
I'm hopeful that that's the case. You're right that we've got vaccines available now, and we're keeping patients out of the hospital, those that are vaccinated. And it at least appears that this Omicron variant is not any more severe than others. We've also learned a lot about how to provide good intensive care for patients who have COVID over the past 2 years.
And that said, are hospitals like U Chicago equipped right now to deal with the surge in patients that are coming in?
It's a challenge all around, in part because of the numbers of patients coming in, but also because of our healthcare workforce that is also occasionally coming down with COVID and getting exhausted.
And since your specialty is in pediatric infectious diseases, are you expecting a booster shot to be approved for kids 12 to 15 soon, and could that be helpful?
Yes, we're excited that that announcement hopefully will be coming very soon. And as a pediatrician, I love nothing more than vaccines. So I'm very excited to be able to offer additional prevention to our 12 to 15-year-olds.
And we're seeing with all ages trying to get testing either at home or in public testing places, long lines, shelves that are out of stock of at-home tests. What is your advice to someone who wants to get tested right now and isn't sure where to turn?
I really wish I had a magic way for us to all get tested, because it's a big problem. You know, the at-home tests are really helpful in telling that if you have COVID, a positive test is very meaningful. The PCR-based test, if available, and if you can get a result in a reasonable amount of time, are often preferred, but there's not a lot of testing capability out there. And as we head into a holiday weekend, that makes it even more challenging.
And is there concerns now that there are growing evidence that perhaps some of the at-home tests aren't detecting Omicron quite as well as other variants?
I think that the jury is still out. And again, you know, a negative test on a rapid antigen test is not as helpful to tell you that really there's no COVID infection as a positive test is. There's so many variables, including how well you do swab your nose and where in the disease course that you are. They are still an additional important layer of safety that we can be using, but they are not perfect.
And as we mentioned at the top, I mean, we're seeing almost unmitigated spread right now, 30,000 new cases a day. Are vaccines preventing Omicron, or are they just preventing serious disease from getting Omicron?
That's a really good question. And in part, we don't know precisely because we haven't had a chance to do the sort of comparisons about rates of infection after exposures in people who have and have not had the vaccine in terms of whether it prevents any infection at all. We're seeing a lot of breakthrough infections in vaccinated individuals, but those are almost always mild, sometimes even asymptomatic. Really what we're seeing is it's the unvaccinated individuals who are getting much sicker when they get Omicron.
And certainly that's been true since vaccines have been widely available. Does it make sense to you that the CDC downgraded the quarantine time for someone, at least who is asymptomatic, who tests positive, from 10 days to 5 days?
I think potentially for economic reasons, I understand it, but from a, personal preference, I like being a little bit more conservative and having a little bit longer isolation period. And we know this is such a transmissible strain of the virus that every little bit of safety that we can layer on helps.
And for folks right now, they're on the fence about New Year's plans. Should we get together? Should we go to a party? Should we go to a public indoor space? What is your advice to them right now?
I hate to be a killjoy, but I really think it's still not the right time to get together in large group gatherings. If you need to get out and see people and celebrate for New Year's, I definitely recommend doing it as safely as possible. It's hard to do outside in Illinois in the winter, but rapid test before you go, masking all the time, trying to keep the group to a smaller number. And, it's best to leave your mask on all the time and not eat and drink, which I think is part of the fun of getting together.
Absolutely. And as an infectious disease specialist, we've seen the cases in South Africa dip pretty rapidly. Do you anticipate that will be the case here? And when do you think that peak might occur, at least in Illinois or Chicago?
Sure. I definitely have a hope that we will eventually start tapering down. It's hard to predict when, because I feel like we are still very much on the incline. And it will be interesting to see what happens as we bring kids back to school, where, frankly, they're in a more controlled environment with masking as opposed to potentially visiting with relatives over the holidays, whether that's going to sort of help us control the cases or will lead to more spread.
All right, something. Obviously, the CPS CEO has his view on that as he is welcoming kids back to school on Monday, January 3rd. And our thanks to Dr. Allison Bartlett. Thank you so much for joining us.
My pleasure.
And there's more Chicago Tonight ahead, so please stay with us.
thousands of Puerto Ricans are taking to the streets to protest massive blackouts.
Over the years, Mexican culture, from food to music, has become woven into the city's tapestry.
Medical professionals share the latest recommendations on COVID-19 booster shots.
DACA recipients have been facing longer delays than normal in their status renewal.
Little Village is one of my favorite neighborhoods. This neighborhood comes together to celebrate such an important day in our culture.
And there's much more ahead on the program, including a look at COVID's impact on dialysis patients. But first, have you ever wanted to get a fish but had no idea where to start? Chicago Tonight's Joanna Hernandez recently met with an aquarist in Wicker Park who began creating educational aquarium videos during the pandemic, which led her to a new business venture. Here's another look.
Jamie Dalton doesn't have any furry pets, but has plenty of aquatic friends.
Someone asked me the other day how many fish I have, and I don't know. I mean, I would have to ballpark around 50.
From Harry, the eastern musk turtle.
Now he runs off with it.
To Lucy, her oxalotl, an adorable salamander.
My mother gave us fish. We were not allowed a dog when we were younger, so we had a lot of fish around. And so I always grew up with fish. I had betas growing up as well. And I always thought it was really interesting to learn more about how to properly care for them, because I do think people maybe have a misunderstanding for the care that different fish and animals need and the different requirements of a healthy setup.
In 2015, Dalton started Aquarium Info, a blog sharing information and tips to help others in building their fish tanks. During the pandemic, she decided to go a little further and transformed her second bedroom into a fully functioning fish studio.
This is going to be a great focal point for our tank. And we're going to surround this by java fern. These are java ferns. They're very narrow. With the pandemic, we didn't have many visitors coming here, and at the time I had 2 or 3 fish tanks, and I thought to myself, what a great opportunity to expand and really take my passion to the next level.
Dalton started creating educational tutorial videos on a variety of topics surrounding the care and options in bringing home the right fish, or as she calls them, wet pets.
I recently made an impossible 2-story fish tank. To do this, I turned one tank upside down on top of another tank. My fish are going to have a fish mansion. Do you think it's going to work? Make sure to keep watching.
It was just a matter of time that her videos were racking thousands of views and going viral.
I never expected it to get this big. It was amazing watching the growth. As I mentioned, over 2.5 million followers across platforms, which is mind-blowing to me.
With a growing fan base, she began selling aquarium kits.
This is a 4-gallon, I call it the mini kit, and it comes with a generous amount of sand that you'll need to kind of lay that foundation that you see here. Dragonstone, so you can choose between Dragonstone, which is this clay-based stone, or Siri stone, which is more of like a dark gray color. And then we also include the aquascaping tools. So a really great first step if you did want to get into the hobby.
What started as a passion project has boomed into a business, one that Dalton says she wants to keep sharing with others.
I'd love to potentially do some more kind of in-person once we're able to and it's safe, in-person events to kind of do demonstrations and really educate people about the fish keeping hobby. There's so much to know, and so many people do have fish, whether that's a betta or a goldfish. So there's a lot of knowledge to share.
I'm convinced you can hear me.
For Chicago Tonight, I'm Joanna Hernandez.
And to watch more of Dalton's videos, swim on over to our website. And still to come on Chicago Tonight, from new regulations on pet stores to changes in Illinois' gun policy, more laws to know for the new year. Dialysis patients have died in record numbers during the pandemic. A reporter looks at the impact of COVID on a very vulnerable population. The future of coach Matt Nagy may be dominating headlines after a disappointing Bears season, but the team still has 2 games to play, starting with the Giants on Sunday. And revisiting our fall conversation with Maestro Riccardo Muti of the Chicago Symphony Orchestra. But first, some more of today's top stories. Chicago Police Superintendent David Brown is addressing the city's rise in violent crime in 2021. According to the superintendent, at least 75 police officers were shot or shot at this year. Meanwhile, police took more than 12,000 guns off city streets. Brown also says the city expanded the vehicular task force in response to citywide carjackings. At a news conference today, the superintendent said more officers will be put out on the streets to engage with communities.
So we remain committed to engaging diverse communities and organizations to reach our youth and others and identify comprehensive strategies for reducing violence in our neighborhoods.
Brown also says he plans to increase the number of detectives as well in 2022. The spike in COVID cases has forced another shutdown. This time, it's the Illinois General Assembly. Sessions have been canceled for next Tuesday and Thursday, January 4th and 6th. The House and Senate will still convene Wednesday, largely for organizational purposes and to empower committees to meet and vote remotely. You can read more about this on our website. Governor J.B. Pritzker announces an arbitrator has decided in the state's favor and that Illinois, quote, can and should require vaccinations for prison guards and juvenile detention staff. The state will require they get their first shot by January 31st. Two new studies are showing promise for the Johnson & Johnson booster vaccine in combating the Omicron variant. One study researched 69,000 healthcare workers in South Africa who took the booster shot. It found the vaccine reduced the risk of hospitalizations by 85%. The studies were conducted during the rise of infections of the Delta and Omicron variants in Africa. When the clock strikes midnight tomorrow, some 300 new laws will take effect in Illinois. They range from changing how gun licenses are processed to regulating pet sales. Amanda Vinicky joins us once again with more highlights. Amanda.
Paris, what kid hasn't tried to make a buck, literally sometimes a single dollar, by selling lemonade? Soon, Illinois youth will be able to do so without fear of running foul of the law.
It's actually called Haley's Law, and it's named after Haley Martinez. It was in Kankakee in 2017. She opened a lemonade stand to raise money for her college fund, and it was shut down by the city because it wasn't licensed. And so it made news of this made its way into the state legislature.
And now with Haley's Law, cities can no longer require youth to get a license or permit to sell lemonade as long as the person is under 16 and that lemonade stand is on private property or a public park. Now, realizing it's not necessarily lemonade weather, but this holds true for other non-alcoholic beverages, so perhaps maybe hot cocoa these days. Now, a couple of other laws, as you mentioned, deal with pets. Starting in early 22, pet shops will only be able to sell dogs and cats they get from animal shelters or animal control facilities. They've got to keep the paperwork to prove that. They cannot sell, this doesn't apply to fish, they cannot sell furry friends born and raised in puppy mills.
Puppy mills are generally large breeding facilities that breed a number of animals and don't really, take care of them the way we want to see our pets taken care of. So we're not saying that those pet shops can't sell animals. They just have to source them through rescues or shelters.
Pet stores will also no longer be able to offer their own financing. State Senator Linda Holmes says some stores had offered wannabe pet owners loans with interest rates over 100%. That won't be allowed going forward.
You certainly can put it on a credit card, and there you've got your finance terms all laid out for you. Or if you want to go out and take a personal loan before you go to the pet store. But basically what the pet stores have always banked on is, I'm going to walk in this pet store and say, oh my gosh, that's the cutest puppy I've ever seen. I need to take it home.
Another consumer protection bill that could save Illinoisans some money will forbid companies from charging early termination fees if the service is terminated because somebody passes away. That is something that Gwen Daniels of Illinois Legal Aid says happens.
If you have a 3-year contract on a cell phone and you die in month 1 or month 2, you can be held, before this act, your estate could be charged for the other, 34 months of the contract, and the early termination fee is based on that. And so this law applies to internet services, cell phone bills, telephone bills, your water service, your electric service, your gas service.
We're going to wrap it up highlighting changes to Illinois' gun licensing law. The Illinois State Police has been working to trim a very big backlog of firearm owners' identification or FOID applicants. Meanwhile, anti-violence groups have been calling for mandatory fingerprinting of all applicants. Now, in a compromise, FOID applicants who want speedy processing can voluntarily share their fingerprints for background check purposes. And I might have just heard a little bit of there. The Gun Violence Prevention PAC, or GPAC's Kathleen Sanson, says that fingerprinting is important to keep guns from dangerous people.
Fingerprinting is important because it's critical that we identify who is trying to purchase a firearm and make sure that that person is not prohibited legally from owning a firearm. And I'll just give you a very easy example. If you look in a phone book or do a Google search for John Smith, how many are going to come up?
She says fingerprinting and then the background check that leads to that is the only way to really verify if a gun purchaser is the correct John Smith. Also in this new law, state police tasked with creating a database of stolen guns to help prevent their resale. Paris, Happy New Year. Back to you.
Happy New Year to you, Amanda. Thanks very much. A lot changing once the clock strikes midnight tomorrow. Well, the devastating health consequences of the ongoing pandemic haven't been limited to those infected with COVID-19. A new report from ProPublica Illinois details the catastrophic loss of dialysis patients. And joining us to discuss her findings is reporter Dua Eldib of ProPublica Illinois. Dua, thank you so much for being here. First of all, remind us what dialysis is and the kinds of patients that rely on it.
Thanks for having me, Paris. So patients on dialysis have end-stage renal disease, which means that their kidneys are so damaged that they can't filter the toxins from their blood. So they have to undergo dialysis where a machine does that for them.
And you write in your investigation that dialysis patients, quote, became the perfect victims of the pandemic. What made them so vulnerable to death with COVID-19?
So that dialysis treatment that we're talking about is a treatment that these patients can't live without. So during the pandemic, when people were sheltering in place or putting off elective surgeries, they didn't have that option. They had to leave their home, many of them 3 times a week, to go to a dialysis facility. Many of them took public transportation or like medical transportation to get there. Once they were there, they were in a room for 3 to 4 hours with other people, so they couldn't isolate, they couldn't quarantine. And on top of all of that, this is a population that is immunocompromised. So we're talking about multiple layers of risk for people who are just trying to get their life-saving treatment. And, when doing this reporting, I was reading a lot of studies and looking at a lot of data. And one of the things that really struck me was a study that found early on that COVID hospitalizations for dialysis patients were 40 times higher than they were for the general population.
And so because of these risks, a lot of dialysis patients stayed home. So how dangerous is that, and how long can they go without getting their dialysis treatment?
Well, that's kind of the other side of this coin, and it's what's so tragic. For a lot of these patients, that risk was too much, so they either didn't go in to get their dialysis, or some of them who were diagnosed with end-stage renal disease during the pandemic didn't start their treatment. And so for dialysis treatment, doctors, it varies from patient to patient, but typically it's a 3 times a week treatment. If you miss 2 treatments, then your doctor really starts to worry.
And you mentioned in your investigation that in other countries, there is a more robust home dialysis treatment system, but not so here. Can you just explain that a little more?
Yeah, so there's different types of dialysis. So one of them is hemodialysis, which is what we typically see with, the tubes and the blood and what happens in the different dialysis centers. Another kind of dialysis is typically done at home. It's peritoneal dialysis, which can be done while the patient is sleeping. It's, they can do it kind of at their bedside. And so that is something that's more popular in places like Hong Kong and Thailand, but it's not something that we've really adopted here in the US. But there is a big push to adopt that because research has shown it has either similar or better survival rates. It gives the patients more flexibility. But one of the problems with home dialysis and just with dialysis in stage renal disease overall is just the racial disparities. And that's something that we see both with the patients who start out with just chronic kidney failure, which is something that many people in America have, but to progress to that level, to get to end-stage renal disease where you have to be on dialysis, you see Black patients are disproportionately more affected by it. And the same thing with home dialysis, they're less likely to be on home dialysis, Black and Latino patients.
And I want to go back to what you said. Did you say 40 times, the people on dialysis, 40 times more likely to die or to be hospitalized?
To be hospitalized.
And was this data that the state was privy to or anybody was privy to, or is this just surfacing now?
So this was data, so it's been trickling in, and it's something that they're going to continue to study, but there was initial data that was coming out towards the end of last year when they started to see just kind of this devastating effect on the population. And one of the criticisms that I heard during my reporting over and over was the vaccine rollout and why dialysis patients were not, kind of initially prioritized early on back in December when, this data was known. It wasn't until March that the federal officials partnered with dialysis facilities to get them the vaccines in the dialysis facilities, which is where they're at, 3 times a week.
And what's the situation now? I mean, are dialysis patients at least less vulnerable if they're vaccinated?
Well, definitely the vaccinations help, the boosters help, and there's a question of, if there's a second booster, if they will be prioritized then, because this is something that, unfortunately, one of the, the biggest findings in this story is that every time there's kind of a surge in deaths, you see the surge in dialysis population deaths as well. And so what ended up happening was that last year overall, an additional 18,000 dialysis patients died, more than would have been expected from, the year before. And so for the first time in history, the total dialysis population actually shrunk.
Wow, and not for good reason there, as you mentioned there, because of the COVID-19. All right, important reporting. Our thanks to Dua El-Deeb. Thanks so much.
Thank you for having me.
And up next, a preview of the Bears' Sunday matchup, so stay with us. The Bears have a chance to finish a lost season on a high note, starting with the last-place New York Giants visiting Soldier Field this weekend. But there are questions as to who will play quarterback, and then the bigger picture questions of where exactly this organization is headed. Joining us now is James Big Cat Williams, former offensive lineman for the Chicago Bears. James, Happy New Year, happy holidays, great to see you. Foles started third stringer, looked halfway decent against Seattle. Is it a sign that perhaps maybe the Bears didn't need Dalton after all? They should have just gone with Foles or Fields?
Well, I mean, you think back to all the conversations when Pace first got here, when, 7 years ago, and when Nagy got here, all the conversation they had about bringing in a young quarterback every year and being able to groom young quarterbacks. And, we haven't seen that. We got Justin Fields, and he is our young quarterback to go with right now. But where are the young backups behind him to help that they needed to help groom? Yes, we probably could have gone with just Foles this year and not paid the extra $10 million to Andy Dalton. But Foles did what he does. I mean, he's a viable veteran quarterback who you expect to be able to come in on short notice and know the game plan and know it well, and he did that.
And speaking of Fields, he's nursing an ankle injury after that ribs injury. We don't know if he's going to start or not. Is it better to get him in there, get him more experience, or shut him down for the season and keep him healthy for next year?
No, I think if he can play, he'll want to play, and he should play because – 2 extra regular season games is good for him. It's a good way for him to get experience it's good learning experience for him. So to keep him out it doesn't do him any harm, but it does him more good to be in the games.
If you're a player and you know that the last 2 games of the year here, any chance at playoffs are long gone, there's likely to be a new regime next year, how do you get up and play this game on Sunday?
Well, you know that every snap is on film. You know that every down that you play and everything that you do right now is being scrutinized, not only by yourself, not only by the coaches, but, you know, these are things that other teams are going to be able to see. So if that's not enough motivation to get you up for every game, I don't know what is.
And it seems like the Nagy era is about to end, although we don't know that for sure. Less certain is the general manager, Ryan Pace, who only has 1 winning season in the 7 years that he's been here. Would you predict that Pace might be out the door with Nagy?
I'm not putting any predictions out there, Paris, because honestly, I thought they both could have been gone last year. So for them to come back last year and say that they were both going to get another bite of the apple, nothing has shown me that it is a definite that either one of them are going to be gone.
And, you know, the Bears have this 2-week window now where they can make preliminary contact with possible head coaching candidates, but they haven't fired Nagy yet, if that's what they're going to do. Are they waiting too long here to get this ball rolling?
No, I think you do need that 2-week advantage, especially if you know upstairs that, you know, you're going to get rid of the head coach. So, you know, they either way they're going to go, they need to make a move soon. You would think that they, you know, with all the reports that we heard earlier in the season, that they had a direction that they wanted to go, but I'm not sure, and I don't think anyone knows except for, you know, probably George.
And for what we can glean right now, maybe George or the board there doesn't even know quite yet exactly what they want to do, or they haven't decided. Speaking of the game on Sunday, the Giants are worse than the Bears at 4-11. They have their own quarterback issues. What kind of matchup is this for the Bears?
Well, this is a game where, you know, I'd like to see the young players have an opportunity. Bring the Graham Juniors out and, you know, bore them. And if Jenkins is healthy enough to play, allow him to play. And, you know, let's see what these young guys have. You're fighting for next season, not so much for another win this season. You want to know what you have. You need to know what you need. And, you know, that's from the top of the organization down.
And to that effect, Big Cat, what's your bold prediction for Sunday?
Well, I think this is a game that the Bears can pull out. I think the Giants are in more shambles and disarray than they are, not to mention, you know, you could have Glennon starting at quarterback, somebody that I think the Bears defense can take advantage of. So I'm going to go 24-17 Bears in not so close of a game.
2-game winning streak, and you mentioned Glennon there, the former Bears quarterback, Mike Glennon. Before we go, Big Cat, obviously the NFL lost a giant as big as any figure in the sport in John Madden yesterday. Your reflections on Madden?
You know, Madden got me in trouble a lot in college as far as being late to classes, staying up and playing Madden too late in the evening. But, you know, he was a great coach. He was a great teacher. You know, I learned a lot of things about him after he had passed away, just as far as his background in being a teacher and how that made him so much more of a coach, how it helped him to explain things to his players, how when he became a broadcaster, it helped him explain things to the people out there. You know, being on TV is a little different than being on radio. You have to explain so many different things on the radio, but as far as TV goes, he was able to explain the things that he knew that he didn't think the audience knew, instead of explaining to them what they already saw.
Yeah, and I'm sure it was exciting when you knew you were going to be playing a game, getting the #1 broadcasting team of Pat Summerall and John Madden to call your game. All right.
Well, that's all you wanted to hear was your name called out by John Madden.
And I remember your name called out a few times in those years. All right. Our thanks, as always, to James Big Cat Williams.
Have a happy New Year's, Barry.
You as well. And finally tonight, a look at a Chicago cultural treasure. In September, the Chicago Symphony Orchestra announced that the 10-year contract of music director Riccardo Muti, which was about to expire, had been extended for 1 year. On the occasion of that announcement, Chicago Tonight sat in on a rehearsal at Symphony Center, and arts critic Hetty Weiss spoke with a special guest, none other than Riccardo Muti himself. Here's another look.
So I just watched a rehearsal that you're having for your opening night performance, and the connection between you and that orchestra has something special. From the very start, there really has been a magic connection between you and the musicians of the Chicago Symphony. What is that all about?
You know, this is difficult to explain, but from the first time I was invited to conduct the orchestra, and I remember that from the first rehearsal, not the first rehearsal, the first bar, immediately from this beginning, I felt that I had in front of me not only a great orchestra, but a special orchestra, but not only because of the brilliance and the excellence of the brass, because in that period the Chicago Symphony was around the world always considered the famous because of the exceptional quality of the brass players, the tromboni, trombe and horns. But I felt immediately that were also woodwinds and strings very, very special. And special became our relationship. You know, everybody knows that I'm not a person that likes to make compliments, to say how good you are, how lucky I am to be here. So I do my work, you do your work. We seem to reflect, I in the orchestra in me. Then we did a tour, and tours, international tours, can make the relationship between an orchestra and the conductor more positive, more beautiful, or can turn in a disaster. Because, you know, every day, different program, traveling, tired, the hotels, etc., etc. It's like some marriages, you know. Every day, every day, every day. Or when you eat every day, even if you eat the prosciutto every day, maybe at a certain point when instead of 6 days of prosciutto, then the 7th day you receive a cabbage for breakfast, you find that the cabbage is wonderful.
In the 3 different concerts that you're going to be doing, there are the big names, Beethoven, Brahms, and Tchaikovsky. In the first concert, it's Beethoven. And tell me a little bit about the Beethoven you're playing.
Beethoven is like Leonardo da Vinci, like Michelangelo, like Dante. They are eternal. So every generation of musicians and then every generation of the public, they must have the experience of absorb the messages in music of this great genius. The musicians need the Beethoven like we need bread at the table. We should not forget that the Chicago Symphony is an international institution. It's not only a local institution. If you go in any part of the world and you say Chicago Symphony, they will hear the name with great respect.
You are going to be continuing your job as music director of the CSO for an extra year, in part because the pandemic kind of robbed you of 1 year or more. And I'm wondering how you feel about that.
As I said to the musicians, I will still continue to be near the musicians because I love them. I love Chicago. It's a beautiful, I always say, around the world, that is the most beautiful city in the United States. È vero, with the architecture, with the culture, etc., etc. More should be done, and we must do for bringing the orchestra to different parts of the community. We should not abandon the fact that music is an experience of contact between the players and the public. And we need the electricity, the attention, the participation of the public in a positive way, or also in negative way, in the sense we feel that the public is not liking doesn't like what we are doing. Or maybe if we feel that is with us, they can give us more energy. So the experience of a live concert is absolutely necessary.
I don't know about you, but I could listen to him talk all night. Again, that was our Hetty Weiss with Maestro Riccardo Muti back in September. Muti is scheduled to conduct a Beethoven program starting January 13th. And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that is our show for this Thursday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news. You can also get the show via podcast and the PBS video app. And please join us tomorrow night at 7 for a special Year in Review. And now for all of us here at Chicago Tonight, I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and have a wonderful evening.
Closed captioning is made possible in part by Robert A. Clifford and Clifford Law Offices, wishing all a happy and healthy holiday season.